Then we have these terms of movement: abduction, which is a movement away from the median plane, and adduction is a movement toward the median plane. Flexion is a movement of bending, and extension is a movement of straightening. Like, for example, you flex your your elbow when you bend it, and you extend your elbow when you straighten your arm. So you can, if you, these same terms of movement are used for the knee joint, for example, but they are in opposite direction. So for example, in the knee joint, if you try that on yourself, when you do extension, it's an anterior movement. But when you do extension of the elbow joint, it is a posterior movement. But both of them, the extension is straightening and flexion is bending. The word rotation is used when something is rotated around the longitudinal axis, as we will see in the atlanto-occipital joint between the atlas and axis vertebra. For example, when you turn your head around, like when you say no, for example, this is implies a rotation of the atlantoaxial joint here. We have protrusion and retrusion. This is used, for example, for the mandible, protrusion, and then retrusion or retraction of the mandible. Of course, this is not the only movement that takes place in the mandible. There are other movements, the movements that take place at the joint here, the temporomandibular joint. We have protrusion of the scapula, for example, when a straight punch is delivered. So the scapula moves forwards on the thoracic wall. And we have elevation and depression. Again, they are used for the mandible at the temporomandibular joint. This is depression of the mandible. Here's the elevation of the mandible. And they are also used for the scapula. Like, for example, elevation of the scapula takes place when you shrug your shoulder. When you say, I don't know, for example, and then you shrug your shoulder, you are elevating your scapula.